The following segment on Eyewitness News is sponsored by Living Well.
And welcome to today's edition of Ask the Expert. I'm your host, Shay Paul. And today I have Dr. Jared Chapman of Living Well joining us. Dr. Chapman, thank you so much for being with us again.
Thank you for having me, Shay.
Yeah, so the last time you were here, I know you talked about August being Juvederm month, correct? And we talked about fillers and the longevity of fillers in certain areas of the face. Today we're going to talk about the migration of fillers.
Correct. So, what does that mean? Patients come in and
Mm-hmm.
I think my filler has migrated. So, migration of filler is filler showing up in the tissue in a place where it wasn't placed. That's basically what we're saying. So, can filler migrate? Yes, it can. What is the most number one reason for migration of filler? Either overfilling the area or putting the filler, the hyaluronic acid, in a plane in the tissue where it does not belong. So a lot of times filler, what I see is placed in the wrong space, and that
Okay.
allows the filler to move through the tissue and go to places we don't want it to go. One of the most common places I see this is the lips.
Mm,
See that ridge coming up
yes.
above the lip, and it almost looks super full up in that upper lip.
Right.
That is filler placed in the wrong space and possibly could have been filler that migrated. So I'm seeing a lot more of that these days because we have a lot more people out there injecting filler.
Right.
And a lot of times, people go to these places that are less experienced and they end up with migration of filler, and then we have to dissolve it. That's the next thing. Can it be dissolved? And yes, hyaluronic acid fillers, if that's what we're dealing with, can be dissolved with an enzyme called Hylenex or hyaluronidase, and the brand name is Hylenex. That's what we use here at Living Well to dissolve migrated filler. It probably can take up to 2 to 3 treatments to get it fully dissolved, depending on what filler was used and how much filler was placed into the space. But yes, we do see that from time to time. And I'm going to just say this too, in the hands of the best instructor or the best injector, you could still have migration of filler sometimes. So, I'm not just saying it's all due to inexperience or it's all due to, mishandling or putting the filler in the wrong place. Sometimes even the best of us can have this happen. So
Right.
the good thing that the public needs to know, that the people watching, it can be fixed, and it
Right.
should be fixed so that you continue to look natural. And I think that's the thing. Stings a little bit when it goes in for about 3 to 4 seconds. It's kind of an intense sting, and then it stops stinging. And over the next 12 to 24 hours, the hyaluronic acid kind of dissipates from
Dissolves. Okay. Okay.
and it goes down. There will be some swelling, there could be some bruising, but it does take the hyaluronic acid down. It's the same thing we use if we're injecting someone and we would have a complication. We talk to our patients when they come in about being able to dissolve these types of fillers. And that's why I like to use only hyaluronic acid, mainly because it is reversible. And so, for a safety issue, it's definitely where I like to rest my hand when I'm injecting. Um, I do think that there are a lot of people walking around that have been getting filler for a while, and they're starting to see this extravasation or migration of filler to areas where,
Yes.
they
I've
can
seen
always
it
help
affect
it.
people's speech,
Yeah,
truly.
yeah. So let's get the full and they can't move properly.
Right.
Always they can come in, see us for a free consultation to look at this to see if that might be what's going on. And, a simple fix may be just some hyaluronidase, dissolve everything, wait a couple of weeks, and then if they want to refill the lips, then it can be
Yeah.
done. It can be done properly. So,
And certainly, if anyone watching has had reservations maybe about having injections due to this reason, you
right.
just put their fears at ease. Right.
Yeah.
So thank you, Dr.
Yes.
Chapman.
It's definitely knowing the anatomy, knowing the plane to inject the product, and making sure you don't over inject the area. I will say this quickly. I know we're coming to an end of this segment, but the problem with aesthetic medicine is that there are many out there that don't treat it like real medicine. And in real medicine, the patient cannot dictate the care. The doctor must dictate the care, or the provider must dictate the care. And when someone comes in and says, I want 2 syringes of filler in my lips, that may not be appropriate for that patient. So, I'm just simply saying that we have to realize this is real medicine and must be guided by healthcare professionals, and we must protect our patients in overfilling them.
Because your reputation is on the line, right? Okay. All right, Dr. Chapman, thank you so much. We appreciate you being with us.
Thank you for having me.